So maybe I'll start off then and ask you, people here in Singapore are very interested in what's happening in China. So how do you see things playing out in China? Do you foresee a kind of rejection of the traditional standards, for example, informed consent in China?
No.
How do you see this change in the world order panning out in this region?
Well, first, I can assure you people in the US are also interested in three things. China, China, and China. Right? So it's not just in Singapore. Look, there was an interesting moment, and I actually write about this in the book, after the Eugene Kui episode, right, with the genomes of the three embryos. There was a several-week period in which there was a lot of speculation. Would the PRC decide, the West says he violated the rules, but why do they get to decide what the rules are? Right? China has its own ethics traditions. Why should we listen to you? And there was a sort of back and forth about this. Journalists, Hank Greeley, our colleague at Stanford, said, no, that's almost racist to say that somehow. And what happened, as you know, is they put him in jail. They put Eugene Kui and his two colleagues in jail. Now, in the US, that would be really hard to do. I mean, if you defrauded the National Institute of Health, that would be, maybe you'd go to prison. But, they just put him in jail. And what happened in the interim was that, 100 and some odd Chinese scientists said, no, this is wrong. You can't do this, right? This is we are part of international community, and these are the rules, and this is wrong. So I think that was quite interesting that was a moment in which there could have been a departure from the rules, but there wasn't. So what's happening here? I mean, partly what's happening is that Chinese science wants to be part of the deal. They want to be part of the world. They want to be part of what some people call the invisible college, where a Chinese scientist might have more in common with a scientist in the U.S. than they would have with their next door neighbor. There's a culture. So far at least, in that case at least, it didn't happen. But who knows, right? I mean, who knows what the downstream effects of a diminished world order could be with respect to what emerging great powers decide to do in the setting of medical science.
Thank you for this fascinating talk. You set aside the issue of whether the rules-based order is sincere and semi-functional on the one hand, or merely a smokescreen for American hegemony. And it strikes me that how we should feel about this trajectory, the seeming breakdown of this order, depends on what the answer is to that. If it really is a smokescreen for American hegemony, it might be good for it to break down. Then it goes back to transparent might makes right. And if that's what's going on anyway, at least you remove the false screen over that. So how should we feel about this breakdown vis-a-vis that question which you had set aside?
So that's the book that you're going to have to write. I set myself the goal of trying to explain why this is important for our little field. That was my goal. How this works out, you're younger than I am. You're going to have a lot longer to worry about it than I will. But I look, I'm going to leave their actual political scientists and people in IR in the room. I mean, there was something to be said for the Cold War. Power was centralized essentially in two places. And then, other people were annoyed about it in the Southern Hemisphere, and the French were sometimes annoyed about it, right? There was a certain, odd stability to that. And it's not clear and people ask me, what are you worried about? I mean, I've written about things like neuroscience and in the military. Am I worried about that? Climate change, okay, definitely got to worry about that. Big implications. I'm more worried about all those thousands of nuclear weapons that we know are going to now, that are proliferating. I mean, I'm worried about that. Bioethics seems pretty small compared to that problem. So I don't know how this is going to sort out, but it feels like a very dangerous time. And yet, I'm not going to argue that America, I mean, I've said to you, America has prospered and not always played by its own rules.
Hi, thanks. I enjoyed the talk. Just a bit of a question, because earlier in your talk, you made a comment where you said, at least you gestured at the idea that that the international order was kind of identical to liberalism, such that illiberal democracies as such were a threat to liberal order, and that seems a bit too strong. At least partly because there are maybe it might be a bit controversial, but Singapore is not exactly very liberal. It's kind of liberal, but it's illiberal in many ways, but still it's very committed to the to the rules-based order. So the connection cannot be that tight.
It's a connection that was made in principle after the Second World War, that the rules-based order would be composed of liberal democracies. Did they define what counts as a liberal democracy? They didn't. What's interesting to me is that when a nation state defines itself as not a liberal democracy, right? I mean, that's more extreme. Yeah, look, there are clearly, there's liberal democracy and liberal democracy. They don't all come in one flavor. And I'm not going to give a public talk in Singapore in which I, become controversial in that respect. But as compared to some other nation states, Singapore counts as a liberal democracy. And look, the U.S. is not a. My wife's a lawyer, and we have this argument all the time. She says, "I thought we were a democracy." I said, "No, the word democracy does not appear in the U.S. Constitution. We are a representative republic, and there are a lot of undemocratic elements of the U.S. system. The U.S. Senate, for example, is not democratic. So as a resident of Washington D.C., I don't have a United States senator. If I were in Wyoming, there would be two, just as there are two from California or Texas or New York. So, and yet, the job is not to define what counts. But when a nation state says it's not, that's interesting. That's my claim.
Wonderful talk. So many issues that would really merit a lot of discussion. We're really looking forward to the book. So to get to more concrete on one issue, so going back to the pandemic, and you ended with this issue of advancing public health versus sort of advancing individual autonomy. And one of the great examples we've seen of that was trying to develop treatments for COVID. And this sort of raises issues, I think, both for the whole world, but Singapore versus England versus the US.
Yeah.
The one nation that really did a pretty good job in terms of quickly discovering ways to reuse, off-label use of drugs and figure it out quickly was England with a recovery trial. I think many people will say the reason that trial happened and worked was in part because a letter was sent out to physicians in England, and they were all part of the National Public Health Service, basically saying you shouldn't actually give these drugs to patients on an off-label basis. You should instead basically kind of force them into a clinical trial, which is sort of, I guess, going in the direction you're talking about. I've been in discussions and raised this issue with major players in the US, and the take I got from many of them was that the U.S. is never going to basically do what would lead to that resolution, which would be basically you change the rules on when you could a doctor could prescribe on an off-label use and say, well, if we're in the middle of a pandemic, no, you doctor cannot provide that. That will basically as an ethical matter, force people to basically go into the trial if they want that treatment.
Yeah.
And I'll point out many of my colleagues at Singapore here actually wrote about this, and kind of there was a push in terms of the World Health Organization and others saying we should kind of go in exactly that direction. So I'm just curious about your take on all of that. And the other final point I'll notice, since you raised the Declaration of Helsinki, it's interesting, that's up for revision right now. And one of the points that you didn't comment on was it pretty much is inconsistent in saying a doctor should, in a research trial, always prioritize the interests of their patients,
Yeah.
which of course is just wrong,
Yeah.
and highlights
That's
that
not what research is about.
Yeah, this is irrational. So too many points.
Yeah, I mean, well, we can talk more about the first one. I don't know that I have anything, Jared, to add to the first remark you made. I mean, it's an observation, and I think that it is true that that's not going to happen in the U.S. And yeah, I mean, as to this question, I mean, the Declaration is so, the whole history, as you know better than I do, that the U.S. does not refer to the Declaration of Helsinki anymore. I think a lot of people in the U.S. don't know that, right? And there was a break because of the position on placebo controls. So we know the same people who, so what can I say? I mean, yes, I know that there's this tension in the Declaration. There's a, this is a very interesting way in which the world order doesn't see things all the same way as we would think. And so I think we're going to see more and more of this kind of conflict, more and more. And it's a good example of how, it's already unfolding. Thank you.
I have one question for you. Thank you very much. I'm Hyuk. I'm a psychiatrist. And I'm glad that listening to your talk. Some years ago, about 30 years ago, I was a research fellow at NIH at Bethesda, Maryland. And I was talking to the researchers there about drug trials, the history of drug trials. And they told me that it took America about 70 years to get it started, and get it on with it. But China is the new kid on the block, And asking them to play the same game, in such short period of time, you have to be a bit more patient, But they're picking up very fast because they go to China to give workshop on drug trial, drug studies, and they're moving very, very fast.
Yes.
And also wondering, as I sit and listen to you, it's a fascinating talk.
Thank you.
There should be more medical students and doctors here. Before I left the hospital, a professor asked me, "Where are you going?" I said, "I'm going to listen to a talk on bioethics." Bioethics? A very amorphous.
Yeah. Yeah.
And he said, "Why do people give talk at 5 o'clock in the evening on bioethics?"
Right.
And I agree with the previous professor, Chancellor Professor Bert Campbell, that I suppose bioethics is best taught at the bedside, and tell them the situation and what it's all about.
Yeah.
My friend here comes from IMH,
Yeah.
and you often, in the patients with a roaring psychosis, without his permission, we sometimes give them some medicine to calm them down. I mentioned this to a friend of mine, an American friend. He said, "Oh, that's outrageous, against human rights,
Yeah.
But to calm him down, because he's going to tear the whole hospital down, he has torn the house down,
Yeah.
I also did some training in my younger days at Boston, at Belmont Hospital at Harvard,
Yeah.
And they did the same thing. When someone who is dangerous, you get into some things quietly, surreptitiously. You may say, well, you infringe human rights, but that night everyone can sleep better. So my point is, where's the best place to study bioethics?
Everywhere. Anywhere there's a professor of bioethics. Actually, there's a kind of a controversy right now. You mentioned giving people drugs to calm them down. There's a controversy in the U.S. right now about a couple of studies that were taking place in Minneapolis when emergency medical technicians would encounter somebody who was agitated. And in these studies, they gave them ketamine. to calm them down. That some of these people suffered medical complications because of the ketamine. So which is an anesthetic, right? And so there's a debate. I think it's going to emerge pretty soon. I will tell you, pretty soon, in bioethics about these studies. Would these studies have been acceptable? Now, part of the problem is EMTs are not, emergency medical technicians, not necessarily in the best position to diagnose how to calm somebody down. But you could say, well, if they're afraid for their physical safety, then, they're afraid for the order of the system, you got to give them something. Ketamine may not be the best choice for this, but so what I'm saying is, where's the best place to study bioethics? I would say on the cutting edge, and these kinds of interventions where the judgments are hard to make. That's a great place. Hard cases make interesting ethical problems.
Well, I think on that note, we should move to the second phase, which is some drinks, and I'm sure Jonathan will be happy to answer more questions one-on-one. What a fascinating overview of bioethics and the rules-based order dating back to 1648. I don't think I've ever seen a bioethics talk.
I remember those days.
And don't worry, next time you visit, we'll arrange several bedside chats for you that you can move
Wonderful.
around the hospital.
As long as I'm not in the bed.
Yeah. Thank you very much. Please join me in thanking John.
Thank you. Thanks.